may I now request and invite Mr. Kamal Narayan Omer for his welcome remarks.
Thanks, Vimi. Very respected health crusader, Dr. V. Santa. It's a sheer pleasure and privilege for us that you spared time, you came all the way from Chennai to grace this event. We are really honored for that. My colleague, Dr. Bobby John in the IHW Council, members of the Council and also our patrons, ladies and gentlemen. I welcome all of you from the core of my heart to this third edition of CSR Health Impact Awards. And I'm really happy to see that the journey which we started to make everyone part of the healthcare agenda has come so long. And this could not have happened because without the support and guidance of all of you. So thank you so much for all that guidance, support, and motivation in all these years. Friends, last week we saw one of the most appalling child death case in our country. Around 150 children died in the state of Bihar in a span of a week maximum, which actually put a big question mark in the efficacy of India's healthcare system. But for me, more than the failure of the India's healthcare system, I believe this points to a much larger problem that the country is facing today. It is notable that most of the families which become, victim of this killer streak come from a very poor background. Undernourishment and hunger, one of the biggest problem which this affected district of Muzaffarpur is facing. Even some of the experts point out that if the kids who died, if they had a meal before night, they might have been able to fight with this disease or infection much better. We all know a hungry, undernourished body is susceptible to all kinds of diseases and infections. Now, why I'm making this point here is to, make all of us understand that when such kind of tragedies are occurring in our country, it is not just the responsibility of the healthcare system. We and you, the corporate citizens of this country, could also have done something in this case. We, or the businesses, are spending almost 12,000 crore rupees every year as part of their CSR. The problem is that most of this fund is going to already well-to-do states like Maharashtra, Karnataka, Rajasthan, or Gujarat. And we are comfortably ending up ignoring states which require it most. My purpose of making this point today here is that when we see many of our industry leaders talking today, I would look forward to see that how they help us making a better impact in the areas where it is needed most. And with this word, I'm looking forward to a lot of other motivational stories also, where some of you have really done tremendous work. And we also look forward to recognize those real campaigns which have been part of your CSR mission and have impacted a lot the society, and recognize them during the evening. And with this word, I welcome you again for this another edition of CSR Health Impact Summit and Award. And thank you so much for being here. Thank you.
Thank you, Mr. Omer, for your opening remarks.